A headache can ruin the weekend. Now, there are a lot of different causes to headaches. Maybe it's just your typical tension headache with tight muscles or tight joints. It could be sinuses, or it could be a full-blown migraine with pain behind the eye, sensitivity to light and sound, where you just want to lay in bed for the entire weekend. The most frustrating thing with headaches is that it could be any of these causes. So the first thing we're going to do in the office is we're going to do a thorough history and a full exam to really determine exactly where this pain is coming from and see if it's something more insidious or something that we can take care of quickly. Now, we're going to talk about a typical tension headache because it's probably the most common ones we see in the office, where we have tight suboccipitals behind the head here, tight upper traps and levator scapula. All of these muscles are locked down, and the joints in the cervical spine or the neck and the thoracic spine or the mid-back may be restricted and just not moving as well as they should. So the first thing we're going to do is we're going to adjust that area. If it's the cervical spine or the mid-back, we'll do a typical chiropractic adjustment, or we'll do a gentle mobilization if that's not something that you're ready to handle. Then we have to address the soft tissue around the area. Now, we may be working up under the shoulder blades. We'll work those upper traps and those suboccipitals, and that could be with my hands. It could be with needles or cupping or tools. Really, whatever the exam warrants us to use, we're going to use to make sure those muscles are, one, not painful, and two, moving through the entire range that they should be. The magic here is going and giving you exercises afterwards to make sure that all of this good work that we did sticks. So let's take a look at a couple of those that we might do. Some of the most common tight muscles that are associated with the tension headache are the upper trap and levator scapula, as well as the suboccipitals. Now, to stretch that upper trap and levator, we want to grab onto the side of a chair. You're going to take the other hand, reach over, grab behind that ridge on the back of the head, hold onto that chair as we pull down and across. When you feel a good stretch, you're going to hang out there for a few seconds. Then you're going to contract to push your head back into your hand for about 7 seconds. Relax, let go, see if you can pull down a little bit further. And you're going to repeat this for 3 rounds, pushing for 7 seconds in that new position you got to, relaxing, pulling further. And you can do this on both sides as well. Now that we've loosened those muscles up, we want to add some strength to the deep neck flexors. For this, we want to take out any extra pieces and go ahead and just lay down on your back. We want to think of not jutting our chin out, but making our spine long. And as we do this, we're focusing on lengthening the spine as if someone was pulling on your hair. You want to lengthen the spine as we lift our head off the table. Now with this, we can do holds of upwards to 30 seconds, trying to keep that long spine, almost creating a double chin. And you should feel this right underneath here. Now with this, you're gonna feel almost like a sore throat or like someone is grabbing onto your neck because of the positioning of the muscles there. But we have to strengthen these guys because making these work better is gonna force the ones in the back to relax. Those are a couple of the most common exercises we'll use for headaches in the office, but it really depends on what we find on your exam. Your treatment should be tailored to you. So go ahead and get on the schedule today so we can do a detailed exam to find out exactly the cause of your headaches and make sure we get you taken care of.